At the Christie, the patients are at the heart of everything we do, and one of the ways to do this is through electronic patient-reported outcome measures, or ePROMs in short. ePROMs are digital questionnaires that allow the patients to share their experience of how their cancer, but also the treatment, is affecting their lives. And the questions can include aspects related to physical symptoms, but also quality of life, or sometimes practical concerns. So this initiative was very much driven by research showing that when you integrate ePROMs into patients' care, that leads to improvement in survival. And our ambition at the Christie is to make ePROMs an important part of patients' care so that patients can get the help they need when they need it. We launched the service called MyChristie-MyHealth in 2019 with the support from the Christie charity, the Manchester Cancer Research Centre and the University of Manchester. The way it works is quite simple, so patients receive a text message or an email 2 to 3 days before a clinic appointment. They can fill in the questionnaire from the comfort of their own home using a tablet, a computer or a mobile phone, and then they submit the questionnaire. And pretty much instantly they receive some advice that is tailored to their response and that helps them to address their symptoms. In addition, the clinical team also review the ePROMs ahead of a consultation, ensuring that they can focus on what matters most to patients.
I'm about to go and see the patient, and as the clinical nurse specialist, my focus is on how they are currently feeling and their current symptoms. Prior to seeing the patient, I access the system and the clinical notes, the investigations and the ePROM. The ePROM gives us the opportunity to focus on the patient's symptoms prior to us actually seeing them in the clinic, and an opportunity for the patient to express maybe more sensitive issues that they wouldn't have informed the clinician in the clinic setting. This gives us the advantage of being able to provide additional support, information to optimise patient care. ePROMs are really easy to use. You access the patient's clinical notes and do not have to log onto a separate system. The patient's symptoms are colour-coded, so you can focus on the most severe symptoms. We also have access to a timeline, so we can compare previous ePROMs to assess how the symptoms have changed over time. Thank you for completing your online questionnaire prior to our consultation today.
I found the questionnaires have made my appointments much more adaptable to my needs. I like the fact that I can share my concerns online and have time to think about what I want to say, especially when something difficult comes up, without feeling embarrassed. I also know my doctors and nurses read my responses because we talk about them and they make sure I get the right support that I need.
ePROM is the centre of my service. I use ePROM to remotely monitor the patients, which helps to streamline the assessment, prioritise my clinical concerns, and helps making timely prescribing decisions, which is especially important as oncology caseloads have continued to rise. So using ePROMs has improved patients' confidence. So we use ePROMs in the clinics before we actually see the patients. So obviously we help to reduce the times when the patients come to the clinic. Sometimes that we don't really have to see the patient in the clinics, and we can obviously, based on the ePROMs result, we can send a text message to the patient knows that we have seen them, so which help reducing the times to actually during the consultation time. And we have carried out an audit recently which shows that using the ePROMs has shortened the consultation times, but also actually not compromising the care, which kind of like makes the patient feels like, even they're not actually attending the clinic, but they feel that they're heard and supported. This digital approach has helped us to improve the patient's care flow, which also have been recognised recently with a national award.
Wow, I mean, this service has been incredibly helpful. It saved me trips to the hospital, allowed me to get on with my life. I mean, with regular follow-ups as part of my treatment, frequent travel would have been challenging, especially as I live quite far from the hospital. I really appreciated being able to update the team remotely, especially knowing that they would review my responses and just get back to me when needed. It, gives me peace of mind and just makes managing my care so much easier.
There is a wealth of research around cancer management and cancer cure, which is fantastic news for our patients because many of our patients are living longer and many cancers that were considered terminal are now more curative and and treatable conditions. That said, the quality of life of these patients are still very poor. And the benefit of ePROMs is that it helps us to identify these unmet needs of patients, which can have a significant impact on their quality of life, but as well as cancer management. We have found that the wealth of data that we're getting from ePROMs can be utilized to analyze specific symptom burden within specific cancers. And with the help of AI, we can even predict what type of symptoms these patients can suffer from. So an even more proactive approach whereby we can inform the patient as to what they might expect when they're undergoing treatment. We know that health inequalities and underrepresented patient groups can be negatively impacted when it comes to cancer treatment. One of the other benefits of ePROMs has been that we are able to identify those patients who might otherwise have been missed out.
At the Christie, ePROMs have transformed patients' care and improved our research. Every year, 10,000 patients benefit from this service, making us the first centre in the UK implementing ePROM on such a large scale. We were delighted to receive a Greater Manchester Innovation Award for this service, recognises its importance for both patients and also for clinicians. ePROMs ensure that the patient's voice is at the heart of everything we do at the Christie.